Good. Well, today we're looking at postpartum depression. It is a condition that some women experience after giving birth. It involves feelings of sadness, anxiety, exhaustion that last longer than 2 weeks. Some persons put it at that number. Now, if left untreated, it can affect the well-being of both the mother and the baby. But first of all, the questions we should be asking is, how do we identify it? What treatment options are available for these women? Who can they talk to get help? That's also one. And how can we support them? Well, my guest is the founder, MasterCoach, which is a coaching and mentoring hub. She is Dr Aishat Adaviruku. You're welcome to the show.
Thank you very much.
We've had her before, but this is the first time we're meeting in person. The last time was via Zoom, and I'm glad we could meet physically today.
I'm glad. Nice to finally meet you.
Extremely glad we could. Thank you so much for joining us.
Thank you.
All right, so we start with the basic, which is some persons talk about baby blues. Some persons talk about postpartum depression. Some say there's a similarity. Others say no, it's a wide difference. So what exactly is baby blues and how do we differentiate it from postpartum depression?
Okay, so when we talk about baby blues, it's a feeling of anxiety, sadness, tiredness that can last for a few days to a couple of weeks after giving birth.
Okay.
Now, the difference between baby blues and postpartum depression is that for postpartum depression, the negative feelings are more intense. You have a feeling of hopelessness, you have irritability, and on the part of the mother, she is unable to actually bond with her child. She looks at the child and there are no feelings. There are no positive emotions coming from her. And one of the core differences too is the duration. For baby blues, it can last for a few days to a couple of weeks. But when this feeling of hopelessness, irritability, anxiety, intense sadness is, it continues unabated for 2 straight weeks, then you know that you're facing a situation of postpartum depression. So you go in and see a health practitioner.
Okay, so how can the family members identify this? You talked about extreme sadness, irritability, but these days we just say, oh, God forbid, or we pray about it, or we speak to a pastor, we speak to an imam, and then there are prayer sessions. But how do we identify and say, no, this person has to see a professional?
Okay, so, as human beings, we are not only a body, we are a body, we're a mind, we're a heart, and we're a soul. So the place of prayers is for the soul. The place of actually seeking help when it comes to mental health issues is to address the emotional and mental challenges that come with that.
Okay.
So you can do all together, but once you notice a mother that does not express joy at seeing their child, and the mother consistently feels tired, the mother is unable to actually discharge her responsibilities, she's drowsy all the time, she's sleepy, she lacks energy, and before then, if you notice that her personality has undergone a drastic change from how she used to be, then it is time to seek medical help. You can support with prayers, but please seek medical help.
Yes, I like how you said it. You can always support with prayers. Everything can go hand in hand, but whilst we go professionally. Now, what are the risk factors that increase the likelihood of developing postpartum depression? Are there any?
Yes,
okay.
There are.
Okay.
So, some of the risk factors are individuals that, during the period of pregnancy had a very difficult pregnancy. They are likely to face postpartum depression after the baby is born.
Okay.
So we have some individuals that go on bed rest, that bleed throughout pregnancy, when people carry multiple children, it's likely to also affect, the stamina with which they carry the baby. Some of these individuals that carry multiple children, they are put on bed rest during the period of pregnancy because of some of the complications that accompany it. Then women that also suffer from depression before the pregnancy, they are also likely to suffer postpartum depression. Then women that face financial challenges. Pre-pregnancy, during pregnancy, and post-pregnancy, they are also likely to go through postpartum depression. So once all this, some of this or all of these are present, and then you also notice the symptoms of postpartum depression, then you should seek medical intervention.
All right, it's still Classic FM 94.3 Abuja. It's focused on how we're looking at postpartum depression, and we have a doctor right here in the studio. You can send messages via WhatsApp 0909 697-5943. Now let's talk about, you've spoken, how is it properly diagnosed in professional health service, and also after diagnosis, what happens next?
Okay, so we have standardized interview and also standardized screening methods used by medical practitioners to diagnose postpartum depression. So when an individual notices some of these symptoms that we have listed, then they go in to have themselves interviewed and tested. And then it's on a scale. So it could be mild, it could be medium, and it could be severe. So depending on, the diagnosis, the medical practitioner can now recommend a treatment option.
And then when the treatment begins for the woman who's going through postpartum depression. Now, if someone decides that, or probably like we've seen in some cases where there were no proper diagnosis, they didn't even go to the hospital, no professional help, what's likely to happen to that mother?
It can cause a worsening of her mental state. Sometimes we say somebody has entered town. The person has, lost their sense of reality. It's because it was not properly diagnosed. The symptoms were not properly caught on time, and treatment options explode. So it leads to a worsening of the mental state of the individual. And not only in this particular instance, not only will the woman be affected short, medium, and long term, but the baby that she's nurturing would also be affected short, medium, and long term.
Okay, now there was I'm going to take you through a story. It happened, I think, in the United States. We've seen two consecutive stories about how two mothers were tired of living with their toddlers. You might have seen that, right? There's a question associated with that, so just let me tell you that story. And you read it just for the sake of someone who's listening. And then these women said that, they were tired, they had a lot, they were depressed, so they left their children unattended to for a week plus. Went on partying. Some of them went on a boat cruise. They had so much fun, and then came back about 7 or 8 days later, opened the door, they realized that the child was dead. Now, when these matters were taken to court, the argument was that they were depressed, and some said it could be postpartum depression. Can postpartum depression lead to that, even when the child is almost a year? Is it still possible?
Yes, it is. Because untreated postpartum depression would keep worsening. In this particular instance, the women may have sought help, and those they sought help from, they weren't listening to their cries for help. But as a woman, right, if you're listening right now and you notice that you have challenges with nurturing your child and self-care, it's time to seek help. There are avenues available for you to seek help. Please seek help. Yes.
Okay, so you're saying that if not properly handled, not properly treated,
it can escalate.
Yes. So that's very, very scary. So it also means that postpartum depression can affect bonding between a mother and a child, and it could last for a very long time.
What we call postpartum depression for men. Yes. In some cases, when men are deprived of sleep because of arrival of a new child, they can also go through a form of postpartum depression. But it's not
but we don't talk about it.
We don't talk about it.
And the men just feel like, oh, maybe it's because of the newborn baby.
Yes.
Wow.
Yes.
So men can also go through postpartum depression.
Course.
Oh my goodness, this is serious.
Yes.
So does the man also need to go through the same techniques that you're putting through the woman through, rather?
Yes, of course.
Okay.
And in some cases, the woman may need antidepressants depending on if it's mild, medium, or severe. If it's severe, she definitely needs medication. Some of those medications may have possible side effects, but sometimes the medical practitioner will weigh it against, what the potential benefits.
Okay. Now, with all that we've discussed, what's I want to know your opinion on the place of probably, getting a help in the house so that, would help the woman, would help the man, and now we have to add the men at this point, that would help the entire family, especially with the arrival of a newborn, because it can be chaotic sometimes. And especially, I don't want to say on the side, for everybody in the house, it's chaotic.
Yes.
So what's the place of getting a help that could help alleviate some of these, problems associated with taking care of a newborn?
It is highly recommended that you get help, get somebody matured, and if possible, train your help before you bring them. And if possible, train your help before you bring them into the house on childcare essentials, on personal hygiene and all of that. Because sometimes we even get a help that will worsen the situation. An untrained help is sometimes more dangerous than not having a help.
Okay.
So we have had cases where some babies were force-fed and it led to them giving up. Yeah. So we need to train our helps when we bring them in. It's something we need to pay attention to. And if possible, get more than one help so that they can rotate too. They're human beings, they can get tired. Right. So you can have maybe one on night duty, one on day duty, if you can afford it. If not, find ways of maximizing
stress.
Yes, maximizing and getting maximum rest as a mother, especially if you're already noticing that you're experiencing signs of postpartum depression.
And, ways they can reach out to someone. If no one is listening in the house, how can these women seek help? Especially when they're trying to demonize it. Like, you need to go through a deliverance session, or you need to go, you need to see, a pastor and imam to pray for you. Now, how can these women say, okay, no, the way I'm feeling is different. I want to seek professional help?
So let them speak to their medical practitioners, invite their partners along, or all stakeholders in the family. And I also encourage medical personnel to pay attention when women come to you screaming silently sometimes for help, because some of these women, they go through a lot. Sometimes the medical practitioners they're under tremendous pressure, and they may miss some nuances. Like I had a client one time, when she was crying in the house for help and her husband was not listening, she had to enlist the support of the long-time medical doctor of the family to speak to her husband. And that was when her husband finally listened and got her the help she needed. So please, sometimes as medical practitioners, as mental health experts, we are the final bus stop for individuals screaming silently sometimes for help, and we should ensure that we pause and help.